Hello and welcome to episode 10 of the Equity Plus podcast from CareShare Health Alliance, where we take a deeper dive into issues surrounding health equity. I'm your host, Erin Story, Director of Communications here at CareShare. In today's episode, we'll talk to Daniella Runyambo, Co-Executive Director at Refugee Community Partnership, about how RCP uses solutions created by their members to address challenges faced by refugee and migrant communities in North Carolina. But first, we're going to hear from Daniella about her own story of what led her to working with RCP.
Hello, my name is Daniella Runyambo, and I am a co-executive director at Refugee Community Partnership. My area of focus is program and community impact. 16 years ago, my family and I moved to the United States, specifically in Maine. 8 years after, my family they heard about North Carolina because it was too cold in Maine, and they wanted to come to a place that is warmer, but also my father is a former physician back home, and education and health care is very important to him. And he heard that the right place to be is around Chapel Hill area because of the great school system, and also a lot of just big, great hospital around the area. So he moved to North Carolina after I finished college. I joined him. We are originally from the Democratic Republic of Congo. So 8 years ago, I moved to Chapel Hill, North Carolina. And my interest was also around healthcare. I was working in a lab doing cancer research. And then I had my experience with my first child, who was born in 2020, in the midst of COVID, March of 2020, right at the beginning of COVID. And my experience with my child was challenging. And that kind of shifted my mind. I was trying to pursue a medical degree. And when I went through the experience that I had with my child, it just changed everything. I come from a country where healthcare systems are not, infrastructures are not there. And I saw my father working really hard to work with nonprofits, to work for the community, as he was the medical director in the South Kivu, which is the province we were living in. So it was almost like a one-man show instead of like being backed up with the government. So when I came here, I had this trust of the healthcare system. When I went through the birth of my child, that trust kind of shattered a little bit because of what I went through. I heard about women of color going through healthcare systems, especially during birth, the hypertension, the survivor rate, and things like that. And I went through almost everything. Yeah, I had hypertension. I remember, preeclampsia that was not treated at the right time. I remember being in pain and asking for meds and being ignored. It's just everything that I've heard in papers that I never thought could happen to me was happening to me. And my child, consequently, too, had suffered from the traumatic experience. So a question, I was like, if a young woman who was educated in this country, who could speak the language, who's having a hard time navigating these systems, what about all the other mothers? What about all the other refugees who come from my country or come from other countries who didn't receive the education in this country, who don't speak the language, who I know for a fact that the healthcare system in my country and in a lot of the country in the United States is very different, who don't have that background understanding. So that kind of like those questions made me kind of rethink about what I wanted to do. So at that time, I was a volunteer at Refugee Community Partnership. Also, I was also an interpreter. And a friend of mine talked to me about an opportunity at Refugee Community Partnership, about this grant that they had received trying to tackle or talk about language access in healthcare systems and supports refugee and immigrants navigating through the systems. And I was like, that's what I need. That's where I need to be. So that's how I transitioned from being a volunteer and interpreter with RCP to becoming a staff. So it was from personal experience, but also I felt like it was a calling for me after what I went through. I knew that that's where I needed to be. So I started working at RCP end of 2020 as part-time, running a specific program at RCP called the Navigator Program. We might have time to talk about it later. And 3 years later, I'm one of the leaders of the organization.
Wow, you really worked up quickly, didn't you?
Yes.
That's such an interesting background again. I'm sorry. I'm so sorry you went through that with your first child. I hope it went better with your others and then it goes well with the one that's on the way as well. But I appreciate that you have the openness to share that as well as
Yes.
what you did with
Yes.
the experience seems pretty amazing. So
Yes, I realized that my experience was never unique when I started sharing it. I realized that it's not in a unique situation. A lot of the women start talking about having their own experience that were very similar to mine. So that's one thing that I realized. And I was like, okay, nobody's talking about this. And everybody is always afraid to talk about this because of not understanding, well, there might be consequence. How can I share this? So when with the understanding that I had, I knew that sharing it was important. And through RCP, there was a healing process for me as well. And hopefully I'll get to share it later. But RCP, through our programs that we're able to create through using our experiences, I kind of had a full circle of healing for myself. And we see the impact of that with the community as well.
that's really beautiful. So why don't we talk a little bit about RCP now? Like what is RCP? How did it get started? What services do y'all provide?
Refugee Community Partnership, also known as RCP, is a grassroots nonprofit based in Carrboro, North Carolina. The organization started in Carrboro, but it supports refugees and immigrants in Orange County, and now we've expanded even in Durham County. What we do at RCP is that we create systems that connect people to resources that they need, and we mobilize also institutions to eliminate barrier to access. So we have kind of flipped the script on traditional services. And instead, we focus on relationship of mutual support and community build initiatives. So all our program, everything that we do stems from real-time priority of the community that we work with. RCP started around 2011, and it started with a group of young activists in the community. One of those young people was part of the refugee community. And around 2011, 2012, there was a community from Burma that was moving around the area. And the young activists were kind of realizing, they were having that awareness that there's a new community that is moving, that is resettling in the Chapel Hill area, Carrboro area. And they just wanted to know their neighbors. They were like, there's a group of people who are here, who are neighbors, and we just like want to get to know them. So they started building relationship. These are people who were living in the same apartment complex as them. So they started kind of like talking and get to know one another, building relationship that moved from seeing each other in the hallway to inviting people in your house to start talking. And when they got to that point where they could go and visit this family, one family member will call their neighbors and to come in and talk to these young people who are in their living room. And when they start talking, they realize that they start having almost like community meetings, unplanned community meetings. And in those conversations, community members, these refugees who were settled in Carrboro Chapel Hill area, were sharing how they were having a hard time, navigating a system. There were language barrier and access to service that was an issue. But also the biggest issue that they also sharing was the social isolation. A lot of them come from community where they live with one another, even though a lot of them come from places where there was war, but that community relationship, community was there. And when they moved to the United States, that was one thing that was lost and felt really isolated, and they wished they had that. So those young activists put themselves together and started their organization with the aim to address these issues that these refugees were sharing with them. And the first program that started with RCP is what we call the Bridge Builder Program. It's all about relationship. So what the program does is that we pair our RCP family with a bridge builder volunteer, and kind of like trying to support that relationship building by unlearning those like savior mentality, which is the conventional services that a lot of people kind of, I'm gonna help you get through this, and instead focus on building relationship of reciprocity and mutual aid. So these bridge builder were neighbors who will take care of one another. These bridge builder will work alongside members by addressing their immediate needs. This can be finding employment or, be a reference at a job employment search or, supporting kids applying for schools, for college, being their emergency contact, support them to get to the grocery store. So, and the mutual relationship there was like both parties would benefit from it. Because now they're in relationship with another family that would bring them in their home, that they would do life together. So that's kind of the first program that started with RCP, addressing some of the easiest issues that community, the refugee that would reside in Chapel Hill were bringing to these young people. So that's how kind of RCP was born. And then later on, kind of like this program grew into, the more people were in relationship with the refugee community and really emphasizing and hearing from the community, people started talking about, yes, they love being in relationship with their neighbors, but they also love the fact that they could be in community together, like where this refugee from Burma can meet with other refugee from Burma and talk about their journey and what they're going through and maybe talk about back home. So some women's groups start forming in response to that. And in this women's group, people will come together, women from the same community, they're speaking the same language, and they will just talk about life, talk about some of the barriers that they will be facing. And one thing that we were hearing a lot from those conversations was language access, the barrier to a lot of services due to language in access in all systems. Healthcare system being one of the major, especially for the ladies who are coming together. They're like, when we're trying to go give birth or any other appointment, we are really having a hard time navigating healthcare system. We don't get interpreters. So those conversations start happening. And so, RCP start growing beyond just pairing families to members, families with volunteer. We start growing and start taking some of those issues and start some few initiatives where we contract with young people in the community to support people to navigate different systems. And that's where we are kind of adapted the language justice framework that we use with everything at RCP. So kind of that's kind of our journey. Our journey is always growth. We are evolving. We are, depending on like the community need. So the RCP of 2012 is completely, it has grown. Now we have community not only from Burma who speak Korean and Burmese, but we also have community who speak Spanish, communities that speak Arabic, communities that speak Pashto and Dari, community that speak Rohingya, community that speak French, Swahili, and Kenya, Rwanda. We've grown to having more initiatives and more programs that we can dive into maybe a little later. But our area of focus, if I can say the core focus of RCP, the way we provide services, so we focus on three things. We focus on supporting people survive, supporting people thrive, and doing advocacy. So everything that we do kind of address those things. I'm talking about 2012, working with community that came from Burma, but we also have 2 years ago, we started working with a new community that came from Afghanistan. So the support there looks a little bit different with people who just arrived versus people who have been here for more than 10 years. But those are the three areas of focus within RCP.
Well, that's definitely a really interesting story. I like the idea that kind of started out where people just want to meet their neighbors, and get to know them and everything. And then like the type of support they could provide their neighbors, but then also focusing on the mutual aid and the mutual benefit instead of like the white savior complex that some of us get when we see people that need help. And this is how we're taught that this is the way to do it. So you also mentioned language justice. How does RCP define that?
Language justice is the framework that is always evolving, right? So the simple way of defining that we define is it's a framework that it's a lens that we use where everyone has the right to communicate, to understand, to be understood in a language that they feel most comfortable in, powerful in, with the mindset that individual and community have the fundamental right to language. They have the fundamental right to culture, to self-expression, and equal participation. we kind of challenge this ideology of English dominance and understanding that, everyone within the community have the right of equal participation. A lot of our institution uses that understanding of like English dominance. And it's not that English can be a popular language, but when we are talking about it dominating, we are talking about the power dynamic that we see when one language or one culture is now dominant and has this power over everything else. So the way we see language justice is addressing that concern and kind of work toward like understanding that everyone has the same right to understand and be understood, to participate equally. So kind of like that's kind of generally like how we view this framework, the language justice framework.
That's really cool. Also, I think it's interesting to even bring up the concept of English dominance because immediately, if you hear that, you're like, well, that's the language of the US. Everybody should be able to speak it to get by. But that's not that it's unique to the US, but there are lots of places where there's not really a dominant language, and that I may be coming from somewhere possibly like that and to the US where it's like everything must be in English or else, it's hard to get by at all. I can imagine that would be pretty difficult.
Yes. And we always talk about it. So if you're looking from the lens of healthcare system, right? So it's like we are a multicultural, multilingual country. And when we are talking about, like the community that are coming, it's not like they are coming out of nowhere. We are set up to support this community, but it's almost like our system never follows because of this mindset that everybody has to. But we also know that language is very powerful. Language, when you strip someone's language and someone's culture, you're almost like stripping also someone's culture, someone's way of expression. So when we are talking about that dominance, it's not like the language itself can be spoken by 90%. But when we are talking about that, I was saying in terms of power, when we are talking about one dominating, it's not just because it's spoken. It's mostly what impact does that language have in the way things are done. And that's a big difference between language access and language justice, because it's that understanding that when you're providing language access, it's almost like a one-way thing. It's like these people who don't speak English, let's provide them with some accessibility so that they can understand. But when we're talking about language justice, it's people understanding that they have their right and taking away that fear that a lot of people have that if I don't know how to address this person, therefore, like this person becomes an inconvenience to me. So what language justice is doing is reminding people, is changing almost like people's mindset and reminding them that no, like language is beyond what is spoken. It's tied to someone's identity. So when someone is different, doesn't necessarily mean it's a bad thing. We just have to we are a very developed country. So figuring out in our ways of life, in our system, how to establish that understanding. Because language access might not be there, which we were trying to have all institutions have established language access. But if you have the concept of language justice, at least you're looking at that person as an equal. And you don't have that understanding, and then you take out language access, that person becomes an inconvenience to you. And therefore, you are now projecting dominance and power over that person. And that's why we try to address a lot, especially when it comes to navigating healthcare system. We're talking about people's safety, and that can go over, that's affecting people's life directly.
Yeah, so that's kind of a good segue into us talking about the Navigators program that you have. Can you tell us a little bit about that and kind of the role that the Navigators play and what it might look like for the member if the Navigator weren't there?
Again, we are a community-led organization, so a lot of our initiatives comes from community members themselves speaking about their need and us figuring out how do we support with all of us at the table, how do we address this need. So like I mentioned earlier, there was a women's group where a bunch of women came together and they were addressing language barrier when navigating healthcare system. And they were saying, like, they were addressing things. They were coming up with all these issues that they're having. Like, sometimes we don't have interpreters. And sometimes when we do, they're not giving us interpreters at the beginning. We are getting interpreters when the doctor is there. And then sometimes they bring us someone who doesn't speak our dialect. Sometimes the interpreters are rude. So there were all these issues that were coming up. And when we looked around, we were like, wait a second, all these institutions that are surrounding us are federally mandated to comply with Title VI, where they can discriminate anyone from country of origin, including language. So they all should be complying, providing language services, which it seems like they're not doing. Not only that, there's also the issue that there's no quality control, there's no quality assurance. Nobody's checking if even those who are providing interpretation, how they're doing it. They are hiring third-party big company that are abroad, and nobody's checking how this interpretation is being provided, the quality of interpretation. But not only that, we have a lot of people who are talking about young people in the community, like a 12-year-old taking their mom to an OB appointment because they have to interpret. That 12-year-old, first of all, is not qualified to do so. But also for those who are qualified, language, like the idea of that being a skill that can actually be developed, professionally developed, and provided as a career is not there for our young people. They're just, now a lot of our young people sometimes don't even, at that age, sometimes don't even want to do the things that they're doing. They're taking their parents to the groceries. They're taking them to the bank. They're taking them to their appointment. All these most intimate spaces where the parents need to be a parent and should not be involving kids. They're taking them to a lot of these social services that a lot of the time put parents in a vulnerable position, and their kids are the ones who are pretty much parenting the parents. So those were issues that we were realizing. So when those came about, and that's how I actually joined RCP, because we did receive a grant around 2020. So these issues were always there before 2020, but when it came to the pandemic, it's almost like these issues were amplified. Because now we used to talk about this, and there used to be no merit to what we're talking about. But now that the pandemic was here, information needs to be sent to everybody. But now stakeholders, governments start understanding that, wait a second, we've had, some people are not getting this information, and we need them to get this information. So the idea of starting to focus on language access became amplified during 2020. So we did receive some funding to start work on this issue. So that's when I came in at RCP and started the program. So the way we started the program is we knew about this issue. So we start working using our personal experience to build it up from ground up. We're like, how do we address these issues that we've heard from community members? Not that we've heard only, but we've also encountered. So that's how we started Navigator program. And the Navigator program is just, we pair a community member to a language navigator. So a language navigator is someone from the community who speaks the language of the community member and also speak English. And they have three roles, let's say. The first is to navigate healthcare systems, supports the patient to navigate healthcare systems. The second is from when the patient calls in that they have an appointment to post-appointment. Like, do we need to go to the pharmacy and things like that? To checking in, to finding the right room, especially when we are talking about big hospitals, finding where to go. So that's one thing that they're doing. They're navigating with the patient through these systems. Second, also, we try to get a navigator to advocate for the patient so that there's language service used when the patient is in the hospital. Because a lot of the time, we will hear specific people say something like, we don't have interpretation for you. We only have Spanish, and that's it. It's not a fact. We already know that these hospitals have language services, but people within the clinic or the department don't know that they have those services. They don't know how to use them. So we do a lot of advocacy for patients to make sure that they are receiving the language service that they need, that the patient is receiving the language service that they need. So a lot of advocacy, but also we also do, the navigator is also sitting down and tuning into the interpretation when the interpreter is provided. to make sure that interpretation is done right. Yeah, there's no abuse during interpretation. There's checking in if it's the right dialects for the patient. They're making sure that there's just right communication, and they are writing down feedback. So at the end of the day, they do complete a feedback form just to look at the quality of interpretation. The feedback form doesn't include anything related to patient, but it includes everything related to the language service for that institution. So that's what language navigators do. Themselves, we try to have them not to interpret because it's not their job, but a lot of the time they'll find themselves interpreting. Also, with the language justice mindset, we always tell people that a lot of the time we think that the appointments start when a doctor is in front of a patient. And that's a lot of the time when interpreters are provided. But no, for the patient, the appointments start when they're thinking about going to the doctors. So when we were developing this program, we start thinking about all that too. Like, how do we support patients from the beginning of the appointment, which is not when they're at the hospital, but when they're thinking about going to the hospital? Because we're finding some patients, because of language barrier, they were not able to understand who to call, how to call. When they're calling the hospital, they're now provided with an interpreter. So even, sometimes they will find themselves going to emergency rooms for things that they should be going to their primary physician for, because they know that if they go to the ER, right away, someone is going to see them without having to explain so much and without having to make an appointment. So there was all these barrier that in our protocol, when we're developing the program, we're trying to make sure that patients are getting the support that they need. That's even if when that support is making an appointment. Or it's like, I'm having this issue, but I still don't understand. I want to call the ER, and we're like, maybe we need to call the primary physician. So then we are supporting. But also post-appointment, there's labs. A lot of people, there's no interpretation when people are going to get labs. And a lot of the time, the lab is not down there. Sometimes it's not even in the same clinic, So that understanding who's supporting the member to do that. There's pharmacy. A lot of our people come from places where when you go to the doctor gives you the pills that you need right there. So, the understanding of like, you're going to go tell me about the pharmacy that the closest pharmacy, you're going to go to get the meds to the pharmacy. That's a foreign language for them. So interpretation when the doctor is there is not enough. So there's those post-appointment support that they also get from the navigator. But there's also that allyship that is very important. Just making sure that you have someone, because it's that power dynamic. Because if you're already you checked in and no interpreter was provided, you are seeing a nurse, no interpreter is provided, and now you're in front of the doctor, the interpreter is provided, I don't think you feel as confident, because there's already this power dynamic that is already there during the appointment, right? You feel like people are just telling you what to do and where to go, and you don't have any autonomy over anything, over your body, over anything that you are able to do. So when you have an ally, when you have someone who's doing that with you, even if they don't provide you with an interpreter at the beginning, that person is there with you, they're advocating for you. Then it's like building that confidence in you and making sure that you know that you have right. They're reminding you of your right. They're reminding you, hey, you should, even though we know that they're not going to give us an interpreter, we're going to still ask for it because we want to remind them that it's still our right to have an interpreter. There's more to just providing the navigation. There's just that partnership as you navigate is also as important. That's why in our program, we also take volunteer navigator. And this can be just anyone in the community who want to support this journey, because the level of need from our community is different. Some community members say, I'm good. When I go there, they give me an interpreter and I'm good, but I need someone to go with, because they give me that confidence to feel like I can navigate this system. I mean, even for people who speak English, it's still it's a beast to navigate these systems, So that's kind of what our program aims to provide. From the program also, we've been able to collect these feedback about language services in different healthcare system, and we use this feedback. So from this program, we're able to start another. It's not necessarily a program, but it's another initiative. It's called the Community-Owned Data Vault, where we are collecting all these feedback, all this data from first experience, so patients' first experience that talks about the language services that this institution were providing. And we use this to do most of our advocacy. So we try to go to these local institutions and present them with data to kind of like say, hey, like we are here together. We are trying to support members with you, and we want to show you how your department is working, how your institution is using the language services that you pay for. And, kind of like working together and bringing that data back to the institution in the hope to agitate for system change. So that's kind of like in general what the program does.
Well, clearly it does a lot. Yeah, I know that when we talked before, I said that one reason that I was so excited to do this particular podcast is because I have done some interpreting. And all of the issues that you presented here, I've seen every single one. I was in primary care, so I didn't see, somebody like in the hospital or something like that. But to see that it's so well thought out and then there's like a community member helping them along and everything through the entire process. I mean, that's incredible. And so I also wanted to ask, since you do have that data, have you ever had something come of it where there was a change in a system due to it?
Oh, definitely. So again, this was an initiative that started. Everything is kind of new, and we are going along. We are working it along as we go. We are learning as we go. So we've used this data in a couple of ways, and we've seen impact in a couple of ways. We've used this data and asked for spaces to talk to residents and medical students about the community experiences that navigate healthcare. And then we will use the data from that institution to give them also, like, we are telling them stories, we are presenting all this information, but we're also giving them data that are directly related to their institution. And this data can be as like, we send the community members to your institution. 3 out of 4 do get interpretation service, but maybe only like 1 out of the 4 feel like they fully understood everything everything went well, meaning that they got a good interpreter, they fully participated in their appointment. So we get to share this, and then we get to share like different where we see these gaps using the data. And what we found out is that we receive a lot of students coming back to us and telling us about how that information has helped them support a patient in different way. That information has helped them advocate for their patient when they've seen maybe a patient being denied a language service, and they get to advocate, they get to remind the department, no, we do have this service here, and we need to learn how to do this. So we've seen that type of impact where people will come back to us and be like, hey, we made these changes, we've supported patient in this way, and we've seen like that happening. Another way that we've seen the impact is, like it's forming that relationship with patient relations, but also the interpretation department at some of these institutions. And this is kind of more of a reminder that, like we are allies in this issue. We are not, it's not like one institution is against another. It's more like we are all trying to support members. That's what we are here for. But how can we do it in a way that is beneficial and effective? So a lot of the time when we receive this feedback, we also support member to file complaints when needed. And we support them to make sure that it's getting to the right people and they're getting answers right away. Again, like when people don't know how to use certain services, when people don't know, that's the one thing that we've seen a lot. A lot of our refugee patients and immigrant patients become an inconvenience. And when someone's already an inconvenience to some caregivers, there's a lot of discrimination that happens. There's a lot of inconveniences and unfortunately patient safety that comes into play. So it's very important to address this and to talk about it. And we've seen where like we supporting members file those complaints, and we've seen like responses quickly, and the members get to appreciate that. Because before, like the patients will have this understanding that if they do complain, there's gonna be some consequence and it's really bad. But as we continue to educate them and them seeing like response from institution, it helps a lot. And we've seen where, like, when we hear the department say something like they don't have language services, not only that we help the department understand that there is language services, but we go back to their interpretation, their language service department, and we say, hey, this department didn't know how to use their language service. Could you train them? And we've seen those happening, like where like we give a feedback back to them and they do something about it, like training a whole department in how to use their own services, internal services. But also another way we've seen this is recently there's one clinic that physicians have come together and they've seen these navigators coming with the patient in appointment, and they start learning more about RCP. And now they're doing a whole research with the aim to change policies within their own clinic on how to support the refugee and migrant community. So we've seen a couple of impacts across. Also, we've seen it from the patient perspective, where we share this feedback back to the patients and the community members to try to make sure that they understand that we built this because of some of the challenges that they expressed to us, and that them participating, them getting a navigator, it's not just as helping them, but they're also helping by changing, by agitating some of this institution. And once patients start understanding that, they want to also be, navigators. Then they're like, oh, wait a second, we're not just like recipient of this great service, but we're also shaping some changes. We also drivers of some changes. We're also creating some solution that not only benefits us as individuals, but also benefits everybody else. I mean, we have one of our staff who literally, I remember my colleague and I gotta give a community feedback on the program. And one of the ladies was like, I knew at first I was skeptical about the program because I was like, is this too invading? And what do I get out of this? Or like, yes, I understand, but this is too much because it's not part of my culture or someone coming with me and doing this. But because I needed it, I took it. But now that you've explained it, I've seen the benefit of having a navigator. But now that you've explained this to me, I not only want to become a navigator myself, but I want to become a staff so I can support other people. And literally that was 2 years ago. That person is a part-time staff at RCP right now and a navigator. So we've seen where by sharing this data back to institution, we've seen a couple of ways the impact of this data being shared back, but also within our community, we've seen some impact as well.
What a cool story about the lady that
Yeah.
is now a part-time worker, even though she was skeptical of the program at first. I feel like that speaks a lot to, I don't want to even say like empowering people, but helping people realize their own power within their communities so that they know that, like you're saying, if the system is not set up for them, they can agitate against the system. And sometimes they can make those changes. Like how cool that the group of physicians wants to change policy because of the way that they've seen how the navigators are so helpful. That's also sort of another question that I had was how RCP holds itself accountable to the communities that it's serving.
So RCP, like I mentioned, RCP started with this young group of people, and starting in our hiring. The conventional thing is like, the traditional way of providing service is like, who's qualified to do this service? What degree do you have? We don't go through that. We look at our community and we hear from our community, and we know that the people who are closest to the issue are the one who should be providing solution to it. So a lot of our RCP staff, starting with, are member of the community. Young people from the community, some, yes, with those degrees, some without, because they are bringing a different perspective. They're bringing a lived experience, and those are valued at experience and expertise. So that's one way that we make sure that we are bringing people who have a hand in the experience to be the one who actually come up with solutions that the community need. So that's one way. Another way is when we start this language justice framework, it's one way to talk about it. It's another thing to live it. It is not as easy, just like any other change in life is not easy. But we wanted to walk our talk. like I mentioned, we were open to bringing people from the community to be the experts that build the community up, and build RCP. But we also we always limited ourselves, like a person has to speak English for that to happen. But we kind of challenged that a little bit. We have some of our staff who don't speak English as their primary language, and we use interpretation as in literally our daily life, our daily working life. And with understanding that interpretation is not for the convenience of the person that doesn't speak English, but interpretation is for the convenience of the organization, because we need to be able to communicate with one another. So this language as a lens was part of our motto. We start walking the talk. And I mean, you said that you've been an interpreter. There's a lot of this simultaneous interpretation. There's consecutive. There's using some tools. There's, there's just a lot of a lot of things. And we just start experimenting, but being really accountable to what we are as an organization. And when the community see that, they're like, wait a second, this is speaking to who we are, So that's another way. Another thing that we do is, so we have what we call community coordinators. These are coordinators of community. They are members of the community, speak the language of the community, who are kind of like the guide or the bridge between members that we serve and RCP as an organization. So every time a member, when a member comes in the RCP, they are greeted in their own language. They have someone who speaks their language who is there to support them. And that's just another way that the community feels like they belong. That space of safety, of, funding themselves within RCP. And then we have programs. In the way that we do programs, we work alongside members. We don't work for members, but alongside them, meaning that we are getting a lot of feedback just in the way we provide support. And we are supporting members by telling them, hey, we don't have all the solution, but together we're going to figure out. So that's another way, like in the way we provide service, we are accountable to the community because we are hearing them. And the way they interact with their coordinators, a mom is coming and say, I love sewing. How do I in my country used to do this. And then another day we hear someone else saying the same thing. Another day we hear someone else saying the same thing. Then we're like, wait a second, we have at least 10 ladies who have this love of sewing. How do we support them? Then we start initiatives that has a women's sewing group. So in the way we provide service, we place in, because we are working alongside members, we are hearing them, we are building relationship. So we are hearing a lot of these either concern, either things that the community members want to get to do, and everything that we are doing is coming from that. It's being built from what we are hearing and what we are listening from our community members, because it's easier for them to communicate with someone who comes from their community, who understand them, who can value what they're talking about. Another way that we also do this, we have these places called the hives. These are community groups that we formed where we provide all the communication to our members. So in the hives, for each of the community that we work with, their platform is different. For some community is Facebook. We go Facebook Live or we do Facebook messaging, because that's how the community function. That's how they communicate with people back home. That's how they communicate within the community. So we have that coordinator always informing the community and hearing from the community through those hive. For some other community member, it's WhatsApp. WhatsApp is the way of life. People, that's where they share recipes. That's where they want to hear about the pandemic updates. Anything is done in WhatsApp. Businesses that are coming up, you send them on WhatsApp. Flyers that are coming in, you send them on WhatsApp. So that's another, those are platforms where we get to communicate with our members about everything that RCP is doing, everything that is happening within the community. But it's also a platform where community members are able to talk to us about their needs and what need to be happening. We send those communication in terms of like flyers, translated flyers, but also we send voice messages because we also understand that not everybody is able to read or write. So we allow the communication to happen in the way that is right for that community. We also have this group what we call member council, where we get to call community members and pay them for their expertise to come and sit down and give us feedback about how we are doing things. We present them what we are doing. We present them with our goals for the year. We remind them these are things that we are doing that came from the needs that we've been hearing from you. Give us your feedback. So that's where we also like bring expertise of the members to challenge what we are doing or to inform us about if what we are doing from an organization side it matches what the needs are or what we are doing need to be changed because the community has evolved or there's some initiatives that we used to do for all communities that we work with, but then we realized that for some of the community members, some group of community members, those initiatives won't work for them. An example is like the men cannot be in the same space as the women and the children. So when we do something like an RCP Fun Day, where has been a need from the community, but maybe the way we are providing that space is not has been one way for 10 years, but now we have to like challenge ourselves on how to present that space for specific community because it's not working for them. So those are the spaces where we hear a lot of the feedback from the community. We have women's group. Though again, those are also spaces where if we need to like hear from the community, those are also spaces where we go in to ask ladies like what they're thinking about this thing. To get feedback about how we are doing the jobs that we are doing and if it's still relevant. Especially as a nonprofit, we rely a lot on grants and some of these grants are multi-year. So being that flexibility is needed because the communities are flexible. So we always have to like have these checkpoints and we have all these platforms that we intentionally set up to receive feedback from the community members and to communicate what we are doing with community members.
When I hear you talk about that too, I know that I at least read that one of the guiding principles for RCP is also cultural preservation, especially through language justice. But it also kind of sounds like being able to have that type of connection where you have the hives and you have the groups and stuff like that. And they say they want to do certain things that they might have done in their country of origin. That kind of seems like its own type of cultural preservation.
Exactly. So for example, we have initiatives like women's sewing group. We heard a lot of women from different community talking about this women's group, the sewing spaces that they need to be. So we thought about, bringing everybody together. That was our first thought. Let's bring all these ladies together. Let's provide childcare and bring an instructor and they can learn. And that was good. But we realized that there was also a need, that preservation that was a need and a necessity for the community. And also the community told us, gave us feedback. They're like, this is great, but this is not working for us. We need to be able to like speak in our own language, learn from the way we learn things. So after that, we changed that. So now we have this women's group, this women's sewing group, where the people are providing the instructions are members from that community. It's all done in their language. Even childcare is provided by someone from their community. And we are providing the space. We are providing accommodation, driving members because maybe some of them can't drive themselves, but they're running everything on their own timing, their own way, the ways that speak to their culture. So that's one way where like some of our initiative have that ideology of like preserving one's culture to make sure that things are done the way it need to be done and it's been done within their own culture. And also the navigation that we do, like the hives, the way we provide hives, but also the way when the community coordinator is working with their member, there's some communication that are just done differently, they'll tell you, we need only ladies to be in the space. That's also cultural preservation, or, we need to say it this way. We need to be doing this while talking about this because that's how it's done and that's how it needs to be done. By having those members of our staff being part of the culture, it makes things way easier. to make sure that we are doing things the right way.
Yeah, absolutely. That way you don't have to, you actually can hear from someone from the community instead of having to rely on somebody that either might know or thinks that they know something about a community that they're not really part of. So that also brings me to something you mentioned before when we had our previous discussion about RCP wanting to stay grassroots.
Mm-hmm.
And it's so that does that have to do with being able to get feedback from your community as long as you're a grassroots organization?
Yes, so like we are community led, and we move the speed of trust, relationship based organization with because of who we are as just human. That connection is needed. That preserve to even keep that preservation, we need to be grassroots. So for us to actually stay with those guiding North Stars and to be able to achieve them, we need to be grounded in a specific space. Because, like I said, I can even tell you we've expanded to Durham County, right? So we are usually in Orange County, we expanded to Durham County. We are talking about two different county that has two different communities. Our biggest community, African community, is in Durham. Our office is not in Durham. We don't have a huge presence in Durham. And you can already tell some of the challenges that we face when trying to build relationship. We can provide services, but building relationship with a community that you're not close with in terms of even proximity. So all those are things that we have to think through and wanting to stay, grassroots, it's because of these values that we want to keep that would be really hard to maintain if we were to try to be national. But we are very also vocal about wanting to talk about what we do because there are challenges and there are successes and wanting to see, like, to encourage other community to do the same. So it's not that we want to keep what we are doing to ourselves. We want to actually share it because we know that the best people, again, those who are closer to the problem should be the one providing solutions. So if everybody can, have this type of conversation and work within their community, you can build so much from your community. Even the way we provide our navigator support, right? It's different for each community. It's different from each county. It's different from each institution. It's different depending on the community that it's affecting. So we like to provide with a framework and hoping that people would be inspired to do the same thing within their own community. But our values are what push us to want to stay connected and stay grassroots.
The limitations of getting bigger as an organization are kind of interesting to consider as when you're a community-based organization, because what is a community but like a kind of a close-knit group of people? And I think most people want to be able to provide as many services to as many people as possible, but then the type of service might change
Exactly.
if that's the case.
Exactly.
This has been really, really interesting conversation with you. And I just wanted to know, was there anything else that maybe we didn't cover that you wanted to leave us with?
I think one thing that I always tell people about RCP, I always tell people that, with the organization, the people who are working within RCP are the first recipient of the support that they are providing. And every time I always tell, share this with the staff, like, if you can't do this, if you can't be part of this service provision, don't give it. We need to be able to provide things that even ourselves are able to participating in one way or the other. And that has kept us connected, like everybody who works with RCP to some extent, even those who are not necessarily have the first-hand experience, they've either volunteered as bridge builder and being closest to the situation as possible. And that's what keep us moving. That's what motivates us. Because what we provide with RCP, we are the first recipient to receive it. At one point, we had initiatives with providing birthing mothers with some support that came from a lot of our personal experience. And I'm a recipient from that service. I received a doula from RCP. And I think I mentioned in this my personal story, when I started with RCP, I started with a lot of hurt that I was able to turn into a solution with other members who had a similar story by, working closely with them to start this Navigator program. 3 years later, before I was supporting just with my personal experience. I said, we want this, we want this, but I didn't understand the healing piece of it until 3 years later after I had my second child. And I was recipient to the same service I was providing to everybody else. And not that the second time around, I didn't have issues. I literally had issues again. I was on bed rest for a while, and I remember having issues with my providers in trying to advocate for myself. Prior my first birth, I couldn't advocate for myself because in my mindset was the doctors know better. They understand, they are hearing me, they are not deaf, I'm speaking English, they understand, meaning that if they're not giving me any pain meds, it's good for me. I don't know how. But when you're in that space, you're that vulnerable, you trust too much, and that created a lot of hurt. Full circle, I'm having my second child. Now I'm going through the same Navigator program that we started to support other members. I'm getting that doula, I'm getting that Navigator, my family's there, going through the process, encountering another issue. But now it's like I'm a different person just by having that person next to me, by them planning ahead of time what to say, advocating for myself. Not only that, the impact of it was that I didn't have a child at 23 weeks because I was able to advocate for myself and fight for my rights. And even when the doctor was telling me completely the opposite, but also just for my personal healing, like I felt like I was a new person after going through that process. Now I got to understand when members will come back to us and say, oh, this is great. Like I was able to do this. I'm learning this. Now I got to understand my colleague was like, oh, like I want to do the same thing for others because now the circle back, I am now like, I'm now again a recipient of a program that I started myself that I didn't do for me, but I was doing it for everybody else. But it was a process of healing for myself. So that's kind of who we are. Like you hear this story among a lot of our RCP staff, not just members. And that's what motivates us to do what we do because we are closest to the issue. We are navigating this with members. We are not coming in as experts who knows everything. We are coming in as people who have seen it, can understand them. And I thought that's also talk about, the mutual support, the mutual aids that we talk about. We are not just giving this help to the vulnerables, but we are the vulnerables and we are trying to figure out the power within ourselves to agitate change that, again, affect us or impact us. So that's just something that I wanted to share as we conclude this discussion that I always think about, that I'm always really excited about sharing. Like when I think about it, still, I'm like, oh my goodness, like I feel like I can go through anything because I know I'm not alone. And even though like I'm sitting in this space of like I'm like a leader of the organization, but I also know what it feels like to also be a member who's receiving the support from the organization. That's a journey of a lot of us at our Refugee Community Partnership. So thank you so much for the opportunity to be able to share about our organization, to be able to share about our stories. We love sharing stories because it is our story to share. So thank you for giving us the platform to do so.
And thank you for listening to today's episode of the Equity Plus podcast. I hope you enjoyed it as much as I enjoyed talking to Daniella, and I'm so grateful to have had her join me today to talk about her own experiences as well as the work that RCP is doing. To find more information about RCP, you can visit their website at refugeecommunitypartnership.org, or you can find a link in our show notes. If you enjoyed today's episode, don't forget to subscribe to hear more from community leaders and community-based organizations in North Carolina about how they're working to advance health equity. To learn more about CareShare Health Alliance, visit us at caresharehealth.org, and don't forget to check out our hub for community-based organizations working to promote health equity and community voice, the Equity Plus Network, at equitypn.org. That is EQUITYPN.org. We can't wait to connect with you there.